Sway Health.
Hello, Colin Hung here for Sway Health, and I am coming to you from Boston, Massachusetts, where I have been attending the Patient Experience Symposium put on by ICD Events. It is now the end of day 2, and boy, what a day it has been. Today featured a phenomenal keynote from Tommy Whitelaw. Tommy shared a very touching story of his mother. He spoke about how she met his father, the life they lived, the love they had, and the reason why he shared that story was what really brought tears to everyone. He basically said that nobody who took care of his mother at the end of her life asked her for that kind of information. The people just saw her as a patient in a bed, not as a person who was continuing to lead a life. Tommy now spends his time reminding healthcare workers and caregivers that they are part of someone else's love story. And let's be honest, who doesn't want to be part of a love story? It was a really heartwarming reminder that those who work in healthcare have such a profound effect on the people they care for. Here's a short clip of my interview with Tommy.
Well, it's the message I give everyone, firstly, just to thank them for the incredible work that they do, and just remind them that no matter what their role is across that organisation, they have the potential and opportunity to play a part in transforming people's days, maybe even their lives, but absolutely their experience of receiving advice, support or care. And tell me a better thing to do than that. Tell me something more beautiful than that you can play a part in that every day.
Tommy had a great line from his keynote that I want to highlight for you. He basically said, "The standard you walk past is the standard that you promote." Think about that for a minute. It basically means that you as a leader, whatever you ignore, implicitly means that you're endorsing that kind of behavior. I thought that was powerful stuff. Jennifer Karen, who is the Patient Experience Officer at BJC Healthcare, had a similar message on her panel. She told the audience that workplace aggression and personal safety were the hot button issues that helped her to align everyone at her organization, from the executive team onwards. She basically argued that when staff don't feel safe, they won't be able to focus on delivering the best person-centered care to their patients. At the Barrel Institute panel, Marty Carney, who is the Senior Patient Experience Advisor at Brigham and Women's Hospital, stressed the importance of staff in communicating with patients, both from a clinical standpoint as well as a cultural human standpoint. She basically said that staff are the last mile of communications and have a significant impact on patient outcomes, which is why she spends so much time and effort coaching staff on how to communicate more effectively with patients. Now, you know me, I can't resist a good exhibit hall. So I had the chance to catch up with a few of the interesting sponsors here at the Patient Experience Symposium. I asked each of them for their key takeaways.
All right, I'm Warren Mullis. I'm part of the growth team here at FeedTrail. We're a real-time patient experience vendor. We're based out of Raleigh, North Carolina. We help organizations really understand the why behind their patient experience scores, engage with their patients based off of their demographics, and really drive change internally in organizations. So far, having a really good time at the Patient Experience Symposium, and I think my biggest takeaway from the event has been the focus on the employee experience and how it really starts with the employees. And if they're in a better place, that's going to shape a better patient experience. So a lot of both talking about taking care of yourself and taking about your team members and trying to better understand them. And I've really enjoyed that, and I'm excited to continue learning more. And you can get more information on FeedTrail at www.feedtrail.com.
Yeah, thank you. I'm Leslie Kerrigan, Executive Vice President with Patient Guide Solutions. We partner with hospitals and health systems across the country in creating custom patient admission guides, putting information in the patient's hands when they need it the most in a way that they can understand it at the times when they need to be able to understand it. That aligns with all of the discussions that we've been having here as far as humanizing healthcare, making intimidating moments easy to navigate, as well as enhancing communication and increasing understanding. All of those things ultimately will help improve the patient's outcomes, and we're excited to learn more. You can visit us at patientguidesolutions.com.
Yeah, hi, I'm Michaela Price. I work with Raiderate. We are a post-visit solutions, survey solution for hospitals, private practices, and we're really interested in capturing the feedback from patients, whether that's anything to support you online in terms of your online ratings and reviews, or more of that internal patient satisfaction data. How was their experience? Where can you improve? Where are you doing really well? Where can you showcase that amazing feedback to your staff and make them feel excited about what patients are saying towards you? I mean, all the speakers, they're all kind of saying the same thing. It all comes down to kindness. You know, how can we relate to people on a personal level? How can we remember that that patient is a person, that we are also patients, our family members are patients, and how can we take an extra 30 seconds to look them in the eye and relate to them and hear a little bit about who they are, what matters to them, what makes them a human being. And hearing everyone talk about how that really changes, you know, the entire patient perception, the employee satisfaction, how it relates to everything that we're doing in healthcare. And if we're not able to relate to people on a, you know, one-on-one human basis, we're really affecting the level of healthcare that we're getting and the quality of life that our physicians and nurses and anyone working in that space is actually experiencing. So I think it's really cool to see how that ties in, and everyone's, you know, really interested in learning how to do better there.
Hey everybody, my name is Randy Perritzman. I'm the co-founder of a company called Family First. I started Family First after an experience spending 10 plus hours in a waiting room while my 93-something-year-old grandfather had surgery to repair a C2 fracture. I joined up with my co-founder, a physician of 35 plus years, to build what is today Family First. We're a provider to family messaging solution that lets medical staff really easily send updates out to the family, whether they're sitting there in the waiting room, went down the street for a bite to eat, or are in a different state. We really free the families from the waiting room and save time for the medical staff. This is our second year at the Patient Experience Symposium here in Boston. It's been wonderful as always. Shout out to Laura Cooley. My key takeaway has been that we need to obsess over patient experience, just like other departments and the hospital organization as a whole obsesses over safety, quality, and anything clinical. Patient experience must rise so that we really go above and beyond and care for everyone that walks through the doors. You can learn more about us at our website, www.familyfirst.io. We'd love to hear from you.
Hi, I'm Nora Herding, CEO of ImageThink, and we're here at the Patient Experience Symposium, listening, synthesizing, and visualizing all the talks in real time. As we've been doing this, I've been listening along, and a few things stand out for me. One really big takeaway was the idea around where the future of patient experience was headed, and there were some really exciting elements, thinking about patient centricity, outbound services, and also how AI could commodify evidence. If that happens, and when that happens, that will make relationships the key component for healthcare providers and patients. ImageThink, we help picture the patient voice and put it in the center of healthcare through the power of visuals. You can find out more about what ImageThink does at imagethink.net.
Now, at the end of the day, I had a chance to catch up with one of my favorite people, Dr. Zev Neuwirth, about his new initiative called Humanistic Rebel Leadership. Here is a snippet of our conversation.
All of a sudden, I just turned to the group and I said, oh my God, this feels like you're like a rebel leadership group. And they all looked around and said, yes, we are. And these are well-established leaders in large healthcare systems across the country. But it almost felt like meeting with the founding fathers of the U.S. It's like, or the founders of the U.S. It's like, it was like that moment of like, these are leaders and they're established and they're business people and they're executives, but they were also rebels. And so I began to realize that if we really want to change healthcare, We need to have a rebel mindset.
Overall, day 2 was another great day here at the Patient Experience Symposium. I really enjoyed all the insights and the conversations. I'm looking forward to the final day 3 tomorrow. This has been Colin Hung here in Boston. Thanks for being here, and I'll catch you on the next video.